For this week's discussion, I have chose to do my video presentation on article When Family Looks Strange and Strangers Look Normal, a case of impaired face perception and recognition after stroke. When someone suffers from stroke, it can affect them physically and cause difficulties that are hard to see. Memory, attention, and making decisions with understanding all are affected. Our brains process an enormous amount of information from our environment around us, then organizes and stores the information in order for us to engage in daily activities. Having a stroke not only affects this process, but it can affect perception and recognition. It can cause a person to have impaired recognition and distorted visual perception of faces after the stroke. In the case presented, a patient JS developed impaired recognition and distorted visual perception after an ischemic stroke. However, it was reported that the faces of family members looked distorted, whereas other people, such as distant acquaintances and celebrities, looked normal. In this case study, the independent variable would be in order to collect data, the patient JS participated in neuropsychological assessments and an experimental face recognition task, where she was shown photos of close family members, celebrities, and unfamiliar people. Explicit recognition and autonomic responses to the photo were then assessed by measuring skin conductance responses. The performance of JS was then compared to 3 controls that were matched on gender, age, and family size. The results from the assessments and the experimental data were then reviewed in light of previously described disorders of face processing. Prosopagnosia, the most extensively described disorder of impaired face perception, which refers to the inability to recognize previously familiar faces. Capgras delusion, the belief that acquaintances such as parents or children have been replaced by imposters, robots, or aliens. Patients with this admit that these imposters truly look like their acquaintances but not identical. Improsopometamorphopsia, facial recognition is impaired as a result of perceptual distortions which are restricted to faces, where patients complain that faces or parts of faces appear torn, warped, distorted, or contorted. And theoretical models for face perception, such as reasoning of JS, case being that distorted face perception and impaired face recognition are somehow related to the emotional relevance of the faces. The experimental task involved JS along with 3 female control participants aged 48, 54, and 58, with no neurological damage or psychiatric illness. They were seated at 1 meter distance from the screen and stimuli, grayscale images of close relatives, celebrities, and unfamiliar people. Photos were presented in 3 blocks each, consisting of 60 trials. After each photo, a question mark appeared, at which point the participants could give a response. They were asked to press yes or no button to indicate if they recognized the person or not. Response accuracy, responses times autonomic responses were recorded. Results showed that controls had 97 to 99% accuracy and recognition of 3 types of unfamiliar face celebrities and close family members. JS proportion of incorrect responses to unfamiliar faces did not differ significantly from the controls. She had a lower amount of correct responses to celebrities. For response times, JS responded more slowly to familiar faces and to unfamiliar faces and to family slower than celebrities. Neuropsychological testing revealed no apparent problems with facial processing and object perception except for an indication of mild integrative agnosia. JS skin conductance responses were lower and peaked later than SCRs of controls, yet both had high SCRs to close family compared to unfamiliar faces. It was determined that a diagnosis of prosopagnosia or Capgras delusion should be dismissed, and that mild prosopometamorphopsia might explain this unusual clinical picture. It was also speculated that the impairments JS was experiencing would be the result of poor integration between identity and emotional-related processing. With any research, there are weaknesses and strengths. In this case, I believe a weakness was only having 1 patient that had history of neurological damage or psychiatric illness from a stroke, along with having all participants go through the neurological and neuropsychological assessments. In this case, only JS participated in them, whereas the controls only participated in experimental face recognition task. I do believe the experiment of the face recognition task was a strength as it showed the difference in perception and recognition of family members, celebrities, and unfamiliar people. As stated, to strengthen research, all participants should go through the same assessments as well as add other participants with history of neurological damage or psychiatric illness from a stroke. Thank you.